it's like all their hands are all over the monkey bars and all these shared surfaces, and it's funny because all these kids think they're being as big and like waving at the camera, like you're gonna look like a real screwed kid. Yeah, you're gonna look like a real kid. Yeah, it's about the most PG way to say.
No, you're right. Out of the 3,000 on buttons that I have in my gear kit, I think I've hit all the right ones.
There's like a good chance one of us could have been programming by now.
Right, exactly. Who knows what's going on? Oh, I'll start rapping. I don't think we're there.
But I do appreciate how long you're there.
Tuesday. Hey, we
I just want to know you could go
yeah,
about
Lee, I think.
I'm going to,
Yeah, I've been watching to see if we can anybody else wants to participate with only 2 people.
We've seen comments just even in the city stream that I think is on that year and a half. It's always impressed watching you guys do it. Seriously skilled. It's impressive.
I never saw a video of that.
When we did the community
Say, I was with the director and
back last August, we had two people and because
yeah,
2 or 3 hour event, you know, and they would rotate in kind of, you know,
we did only 13 on this one. I don't think, like, I know they posted.
oh, is that about the, okay, I wonder.
Remember all the details when you start putting things in the wrong order.
Oh, really?
So
Okay.
if it's anything more than 2 hours, you really need that order, because otherwise you're missing really important information and not even noticing that you're missing it.
Oh, right.
So,
Stuff they're going along and meanwhile they're like,
right, with 2 people, you have one person watching and be like, you forgot that, and vice versa.
hold me 1 second and I'll hit the start button. All right, they're gathering, so.
How about here, okay?
Yeah, that's perfect. That's good for you.
Good afternoon. My name is Frank Haney, Winnebago County Board Chairman, and I am again joined by Dr. Sandra Martell, the Public Health Administrator for Winnebago County, and Rockford Mayor Tom McNamara. We just saw a few minutes ago from the governor and a quick update on cases in the state, 715 new cases for a total of 7,695 cases in the state of Illinois to date, 16 new deaths for a total of 157 deaths total in the state. A couple of days ago, we came before you when we announced the first death in Winnebago County, and the tone in the room was very somber and sad. Today, I will respectfully say that I'm a little angry and irritated over some reports, and I want to speak very directly to that right now. I think it is absolutely pathetic that our Rockford Park District has to take the time to remove basketball rims because some people are not doing the right thing around social distancing. I did hear reports covered by the media and many others that we had a skateboard park where the same thing was happening. I heard other direct reports of individual private sports lessons going on at area clubs. With all due respect, this is a textbook way to get COVID-19. The lack of personal responsibility will endanger the health of residents of all ages. I fear, and why I'm angry today, is that people will die because others do not take warnings seriously. Thank you to those who have taken the restrictions seriously, but we do need everybody on board. As a parent of 3, I ask this of parents and I ask this of young people. No more pickup games, no more private sports lessons, no more play dates. Stop. Studies show us this. People like Dr. Martell, who have been in public health for 20 or 30 years, are telling us that 25% plus of the way COVID-19 is spread are by people who feel great and have no visible symptoms. Why do you think we come before you a couple times a week and report out publicly and transparently to the community our healthcare capacity across our 3 outstanding hospitals? Do you think we are monitoring intensive care beds and ventilators as an exercise or a fire drill? Or is it because we are concerned that if we do not flatten the curve, we may actually need to know these exact numbers? We are, in fact, working very hard, and I want to credit Dr. Martell, the mayor, our hospital leaders, all of the people in the Emergency Operations Center, and many countless others are doing their very, very best to prepare for a surge in case we do not flatten the curve as quickly as we need to. The more COVID-19 is spread in the community, the more potential that our first responders and frontline healthcare workers become sick as well. We are not pulling your leg. So I'm here today and I'm begging you. You need to help keep everyone safe and keep everyone healthy. Please stay home. You will save lives. More broadly, upwards of 90% of the world's population, which is 7.2 billion people, have some type of restriction in their country related to travel. On March 6th, we had 100,000 cases. Today, we just crossed the 1 million mark across the world. The United States has the most cases of any country. On April 1st, yesterday, the U.S. COVID-19 death toll doubled over a 3-day period. Dr. Ezike from the state says it very well. And I think this is part of our challenge right now as the weather gets a little bit better. You cannot eyeball somebody and think that you know if they are sick or not. The more seriously we take this now, the better chance the least amount of people get sick and die from COVID-19. The more seriously we take this right now, the better chance we don't run out of ventilators, ICU beds, and other healthcare work, and in fact our workforce, our healthcare workers, from getting sick. And then we will be able to ensure that we continue to provide the very best healthcare that we are accustomed to as a community by our 3 outstanding hospitals. This will ensure we keep our mortality rates low. The more seriously we take things now, the faster we get our businesses open back up, and the 6.6 million Americans who filed unemployment can get back to work. So that's what we're talking about. That's what Dr. Martell and Mayor McNamara and so many folks in this community, that is what our medical leaders are instructing us. We need to listen. We need to respect that. These objectives are, quite frankly, more important than pickup games and play dates. We all have a role to play. Our actions impact others. So please take this seriously, and please give very special attention to the information that Dr. Martell and Mayor McNamara are going to share with you today. They've done a tremendous job of sharing a lot of good information for this community, and we need to listen to what they're saying and take it to heart. Thank you very much, and with that, I will turn things over to Dr. Mattel.
Today, the Winnebago County Health Department is announcing 6 more positive cases of COVID-19 for a total of 30 confirmed cases in our community. And it's important to understand the ages. They range from their 30s to their 60s. So this is now the 3rd day in a row that we've had multiple positive cases to report. We know that we're starting to move up on the curve. We talk about we wanted it to flatten. We're kind of on the incline here. And yes, the one we need to talking about flatten, we need to continue our efforts. As the curve continues, we know that the disease is spreading in our community, and the chairman clearly stated it. You can't tell by looking at someone that they have the disease. But at some point in this community, everyone will know someone who's been impacted by COVID-19. And while it's a novel disease, and we expect to see a rapid spread, many around you will have the disease. That is, unless we can prevent the exposure. And every day I talk about this because it's important to understand. The only tool we have right now is preventing an exposure. We don't have a medicine. We don't have a vaccine. So what we all have is the actions that we can take every day to prevent the spread. There's a new dashboard out there. As people are at home creating this information, we can look at it on a daily basis, out by Unicast. And it grades communities on a scoreboard to really kind of take a look at how well are we doing on our social distancing. I'm disappointed. Winnebago County only has a B-. And when you think about that, and I'm going to borrow a phrase from the mayor, B's get degrees, but here B's may get disease. So we've really got to think this through. We've got to stop our mobility on. We've got to stay home and stay put. So again, we're asking everyone, this is the tool that we have. It's not a modern tool. It's not a highly technical tool, but it's something every resident can do, which is to stay home and limit travel to only essential food, medicine, medical appointment. We've talked about this. I continue to see very crowded parking lots with multiple individuals going into a store to shop for a family. You are not only putting risk of the workers, the essential workers in the store, who are making sure that we have the goods and services that we need, but you're also placing your family members at risk. And so again, we implore the community to continue. We've got to do better than this. And you can certainly look at the grades, and I said, I'm going to compare ourselves. The city of Chicago has an A-. Come on, we can do better. Cook County, we can do better than this. So most of you know that we're taking a lot of efforts to conserve personal protective equipment. The other area that we're going to talk about today is personal masks. So we're beginning on this, the importance of masking of what we're going to call our essential workers. These are not healthcare workers. These are people working in essential businesses that we've deemed as needing, grocery stores, delivery services, and the use of what we call personal or cloth masks, masks that are made by residents of our community. So we're going to be putting out a request that community members help us to make masks for our essential workers that are not healthcare providers. We want to conserve our surgical masks, our N95s, our gloves, and our gowns for the workers that are in the healthcare system. But we understand that this may be a way, and people have asked, why now, why at this point, right? As we kind of move through it. Well, we know the guidance continues to evolve. Some of the data coming out says people can be infectious 2 days prior to before they show symptoms. We know people are most infectious when they show symptoms, but again, that time frame when a person doesn't even know, it becomes important. They can wear a mask to protect them, from touching their face. I always say it's not a surgical grade mask that's going to protect them from contracting the disease from anyone else, but it stops potentially that transmission to others, as well as our habits about touching our face after we touch something that, is part of who we are. Adjusting our eyeglasses, I have to really kind of think about that when I come in here. All the times you touch your face to move your hair or something else. Those are things that those kinds of masks can do. Now, we will be putting data, or information, I shouldn't say data, information out on our website about how to make the masks, how to, give them and deliver it to us. I'm also going to put another caution out there. Fabric stores are not an essential business. Many people know that you can order fabric online, you can order the essential materials online, but we will not be encouraging any store to open up who's not essential to become essential for this activity. But we know that our community has wanted to provide and support us, and we needed ability to identify when those masks could be used, how they could be used, and how to bring them into our system so that then we could distribute them to our essential workers in our community. So we're going to ask that you go to COVID-19 at WCHD.org to get added to a listserv so that we will send the directions out to individuals. And again, these will then be distributed to individuals in our community who are providing essential services. And I keep, we are all in a kind of a little campaign. You might see it on our social media pages. You're all out here in the community trying to report. And we need others to stay home so that we can continue our essential businesses. Because again, the importance, it's the tool that we have today to flatten that curve, to make sure that we lower the mortality, which is the death rate, and lower the morbidity, which is the illness rate. We need to make sure that we are working effectively as a team. So I understand this is very difficult. We're coming into weeks 2 and 3. The weather's getting nicer. But again, we need to be vigilant about this. It's like taking your medicine every day. You can't skip a day and you go out for a non-essential service. So again, thank you for getting the word out. We need to continue to watch and monitor. We'll be talking as the days come along a little bit more about the models that we're using, about why we're concerned, where we think peaks and curves are occurring, because we're getting more data at this time. But we need everyone who's at home, stay home. Only go out for essential services, and only one person going out for the essential service as needed, so that you can limit the risk to your family and the rest of our community and essential workers. So now I'm going to turn this over to Mayor Tom McNamara.
Thank you, Dr. Martell and Chairman Haney. Really, you both are doing tremendous work, and we're all fortunate to have you in your positions. So our challenges as a community continue to grow. I got to share some of the same concerns. I'm certainly concerned about what I'm seeing out and about in our community today. This disease that we're facing is unlike anything we've ever seen. It doesn't care where you live, what city you call home, what county, what state, or what country you call home. The fastest and most effective way for all of us to help others to stay healthy and to save lives is to stay home. To do this, I certainly understand we all have to sacrifice, and those sacrifices really look different for many of us. We can look at our healthcare workers who are certainly sacrificing. Every day they're doing a difficult job with added pressure of this global pandemic that's placed upon their shoulders. They're dedicated to our community, and I'll say they're so dedicated to our community, and I appreciate that our healthcare workers are dedicated to our community. Right now, there's out-of-town health systems and companies that those health systems contract with who are actually trying to pilfer our workers here to attract them and lure them with high wages, high salaries, high benefits for a short-term amount of time. And I want to say thank you to our healthcare workers who are choosing to stay right here in our community to save our neighbors and residents' lives. And I want to say shame on you to those healthcare systems who are trying to pilfer our community's healthcare workers. Our brave men and women of the police and fire departments throughout our county are out there every day trying to keep us safe. They are literally risking their lives, their health, and every night when they go home, their family and their children's health. We have hundreds of small businesses who are sacrificing and struggling. Owners who have put their entire lives into their businesses, sacrificing their savings, their long-term investments to keep their businesses going. These are restaurants, these are small retail shops. They're all being crushed right now and sacrificing. Our faith community is sacrificing. They are still trying to serve their members through good works and also through virtual sermons. They're worried also about how they pay their staffs and how they pay their bills. To the news media who are out here reporting on this pandemic every single day, risking their lives for all of you to get reliable, trustworthy information. To our grocery store workers who are literally on the front lines, sacrificing so that we can make sure that our cupboards in our kitchen are full. Going to the shop, you should only do that once a week at most. And you should only go there for things that you absolutely need. It should not be used for family entertainment and a family excursion or a reason to get out of the house. I certainly get that. I too have 2 small children that once in a while I just want to get out of the house. However, please use online ordering and curbside pickup. Don't endanger others because you simply want to get outside of the house. The leaders of the Rockford Park District, they're sacrificing and taking aggressive action. They've done so since the very beginning of this pandemic. And as Chairman Haney stated, they're now taking down basketball rims and soccer nets and putting up signs urging people to stay home and not to gather in groups at the parks. I'm asking you, please follow these orders. Our school district today launched e-learning. Completing this project in the public district in such a short amount of time is a huge undertaking and achievement by them. They spent hundreds of hours in the middle of this pandemic getting all of this ready. They're doing this for all of our children. You heard me last week talk about an ordinance that allows the city to fine non-essential businesses for not following the state executive order. I'm here to tell you, GameStop, Mattress Firm, you are not essential businesses. What I would tell those parents is have your kids work on your e-learning and not going to the video game store to buy more video games. The same ordinance that was approved on Monday night that can impact businesses can also be used to fine individuals gathering in groups and not following the state's executive order to stay home. I have not used that power, to which I have, and I do not want to use that power. However, I'm not going to hesitate to use it if it means protecting the health of our community and respecting all of those essential workers who are sacrificing so much for all of us. So I'm going to continue to speak to you all as adults. So I'll be very clear. I said last week that we're using our time now preparing for a surge in cases that we know will come someday soon. And we are continuing those preparations. We are preparing alternative care sites to help for our hospital surge in residents. We know that it is a very real possibility. We might not be able to save every single person who is sick. So when I became mayor in 2017, I can tell you the absolute last scenario I ever thought I would be facing is this one. However, it's sobering, our new reality, and the reality to which we all must prepare for. My very first responsibility to the citizens of Rockford are to make sure that you are safe. And I'm here to tell you I will use every means at my disposal to make sure that you are safe. Nothing is more important to me and the 1,100 people who work for the city of Rockford. Each time we speak to you, I close every single one of these press briefings saying that I know we can get through this together. And that's true today. And the key word in all of this is together. We must remain vigilant. We must stay at home. We must continue to practice social and physical distancing. We must continue to wash our hands regularly and those surfaces frequently. We must do this together, out of respect for those who are truly sacrificing. And we'll take questions.
Questions? Mayor McNamara, you mentioned alternative care facilities. What does that look like currently? Are there any places in particular that the city or the county is looking at?
I'll let Dr. Martell touch on it, but right now we're reviewing multiple sites right now and making sure that our number one goal, Will, is to make sure that every single person who has this disease has the ability to get the care that they need.
I get the numbers.
Oh, yeah.
Yes, sorry, I didn't complete it.
The question was on alternate care, and as you've seen throughout the country, cities across the nation are looking at how to address the surge. And so you'll see systems start to function as one system, not 3 different healthcare systems, but one system, and then being able to put in alternate care sites so that we can triage people to the appropriate level of care that they might need. So our hospitals are definitely in the planning partnerships with us. We are working with our Emergency Operations Center, who is our, I'm going to say, silent. You know, we come every, on our news briefings, but they are working behind the scenes tirelessly to secure the locations, to make sure that we would have what's needed, to make sure that we call out for the volunteers, that the staffing, that the equipment orders are going in. This is a significant effort, which is why it's so important that everyone does their part, because that group is working behind to make sure that when the surge occurs, that we're able to care for everyone that needs care. Now, numbers. As of 8 a.m. this morning, remember we report out 962 tests have been done. 32% of the results are still pending, so the turnaround time in all of the labs has improved significantly. 65% of all our test results are negative, and right now our positivity rate of the results returned, right, is 3%. So we continue to monitor that. Every day we're doing about 150 to 200 tests per day, depending upon, and those results then take a while to come in, but the turnaround time from all of our systems has improved significantly.
A number that's really interesting that is on the release today is the discrepancy in ages that we see nationwide to what's in Winnebago County, where the vast majority of cases are between people ages 18 to 59. Do you have any, guesses or maybe analysis as to why that's the case in our county, where usually it's flipped in most scenarios across the country?
Well, and again, we continue to monitor and watch that. It could be who's doing their social distancing better than others. It could be accessing care at various times. And again, we look at all of that. And I think part of the disease investigation, we talk about this, and I can't get into individual level data, is that there is a whole history and scenario of understanding what other conditions that individual had, what exposures. It could have been a travel, it could be, where they go. Do they go into the city a lot more? Is there more mobility in certain populations than others? But again, we continue to take a look at that, and there are trends. The United States had more younger to begin with than other countries had shown to date. Italy was one of the first to show, but again, we're looking at huge, when you talk about population data sets, these are huge data sets that we're looking at. And we continue to monitor that as well. We continue to be concerned about our congregate living settings where we may have more individuals in the upper age extremes or those with significant chronic health conditions. Again, our individuals that are incarcerated, making sure that they're congregate. So again, we look at all of those very carefully. So we do seem to have a little wider age bracketing, but we continue to look at how we look compared to the state and the nation.
One last thing as far as new information for today. For the 60 cases, do you have the age range on those?
Yes, they are from their 30s to their 60s.
Can you tell us where they're from?
No, we've made a commitment in this community to understand that we do not give that address information specific or what community. Why? Because we know it's throughout the community. And individuals, we've talked about this kind of as an explanation before. When we do the contact investigation, well, I may live in community A. I may work in community B, which may be significant contacts. And my household contacts, obviously are in my community, but all of those individuals are part of that investigation. So I always come back to say, it's throughout the entire community. And so the assumption is that we know that people can transmit before they're symptomatic at this point. There seems to be that theory that's, a couple days before, you can't tell by looking at someone. So it becomes important to understand why we're saying 6 feet of social distancing, whether you live in our smallest community in Winnebago County or our largest municipality in Winnebago County.
This question could go to any of you three, but you've spent the last few days pleading with people to try to get them to adhere to social distancing. I was out and about from the story that Kristen did yesterday on a lot of people congregating. At what point does pleading stop and more actions are taken, and what might those next steps be? Because as you mentioned, the weather's going to be nice coming up. Sunday's looking like a gorgeous day, and it's going to be a time when people have more freedom to go out as far as even essential workers, normally being off. I guess just to kind of wrap up and restate, at what point do you're pleased whether they're made, in a sense of, like you mentioned today, Chairman Haney, anger, whether it's pleading, like you all did on Tuesday with the announcement of the first death. At
Sure.
what point does pleading become action?
Well, I'll say a couple things. Number one, every minute we spend on playing whack-a-mole, meaning we have to chase down individual folks who are not following basic standards that people almost around the world right now are having to follow in their respective communities. Understand that it's going to be seen as a selfish act, and we talk a lot about rights in America, rightfully, but we're at a point of talking about responsibility. So the number one thing is to appeal to what is truly good in all of our citizens, is that you can help keep our capacity of law enforcement, of our state's attorney's office and city legal, who have been working very hard on some of the enforcement side. The health department has a limited number of staff, and if they have to spend a lot of their time and capacity around focusing on code enforcement or chasing down people who are not following basic minimum standards, or law enforcement is focused on that, that's capacity at this point. And just like we want to fight for every available ventilator, for every potential person who will need it, then we're here and we're respectfully asking, but we also, Winnebago County has the largest law firm in this region. It's the Winnebago County State's Attorney's Office. We have a fully functional, strong health department. We are 100% committed, and Mayor McNamara and the City of Rockford have gone a couple additional steps. We are prepared to do whatever is necessary, but at the end of the day, let's go back to what's true about our community. We have great people. We can forget, but we're just offering respectfully a reminder about how important this is. This is life or death. It may not be your life, but it may be somebody else's. So it is both. It is a walk and chew gum philosophy. We need your help and commitment, but if we have to do something more specific, we absolutely will. You've heard that from the mayor, and I'm here to say from a county perspective, we're absolutely will do whatever we need to do to make sure that we are protecting the safety of our citizens.
Have you thought about what those next steps might be?
We're talking internally, and there's ongoing discussions. I believe this is the wake-up call we needed. I believe you're going to see people not congregating. I do not think we're going to have to spend a lot of time babysitting because this is the reminder we needed to have. We will do whatever was within our power to make sure there's adherence to these basic standards. This is not about Winnebago County, it's about the state. It's not about the state, it's about the country. And it's actually not about the country. These are basic standards that people throughout the world are following because of the unique virus we're fighting. I'll turn it over to the mayor.
Along those lines, as we are looking ahead into the future, and I'm reading some questions coming in via text from my Register Star colleagues who are working from home.
Good.
Yeah, tell my boss that too. What does the worst case scenario look like in Winnebago County? How many deaths are we looking at? What is our projected peak death week based on current trends?
So I'm not going to answer that question. It's a great question. I'll have Dr. Martell, she's the expert, answer that. Well, I believe your question was when is the talk going to stop, and what actions would come forward if people continue to not follow the governor's stay-at-home order and all of our pleas. So I'd say we're there now. I think on Monday evening, the city council passed an ordinance providing myself and the city staff the authority to fine individuals and businesses that are deemed non-essential, to fine them up to $750 a day. I would say there's other things that communities can begin to look at, if it's curfews or things of that nature. I would reiterate what the chairman said. By and large, our citizens are really phenomenal and all doing what they should and staying home. But at a certain point, it becomes incredibly selfish from these individuals, because you have folks like yourselves, the news, who are out here risking your lives in a sense. You have grocery store clerks. You have truckers bringing food to those grocery stores. You have first responders, healthcare workers, whatever they may be that are deemed essential. You're being pretty darn selfish by going out and gathering. And we're not going to tolerate it. This is a public health concern, and my number one priority is to keep the citizens of Rockford safe. If that's safe from crime, or if that's safe from a pandemic, or safe from the stupidity and selfishness of a very few number, that's what we'll do. And I'll let Dr. Martelli answer. Sure.
As far as you guys are talking about, we're still waiting for the surge in cases, what would you say to people and residents out there who, we're a couple weeks in, they're getting stir crazy, and are you kind of saying that, hey, we're not even at the point yet? You think maybe we're adjusting to a new normal now, but we still have ways to go in terms of cases are going to keep increasing.
Yep, so the question was, what would I say to residents who are now into week 2 of the stay-at-home order? What would I say to them, as we're not expecting the surge in a couple of weeks? I just want to make sure I get your question right. I would say a lot of us share your frustration, share the kind of feeling like you're locked in a closet, especially with 2 small kids. I certainly share that when I'm at home. But I would say very seriously, this is our responsibility at this time. I mean, I look at, I'll just bring it more personally to me. I look at someone like my father who went off to serve in Vietnam. We're not being asked to do that. I mean, we're being asked to sit at home and watch Netflix. It doesn't seem like that big of a deal in the big scheme of things when we're talking a couple of weeks. So I would say, yes, I certainly feel and hear that frustration. I would say we have several more weeks to go. And May 1st, quite honestly, in my opinion, is optimistic, especially if we continue at the current rate of getting B-minuses for social distancing. I would say the best thing that we can do to get business back up and running, the best thing we can do to get you out of your home and to return to some form of normalcy is to stay home today. And I would say take it day by day and stay home today and find creative ways to engage your children and engage your family members if they're present with you in that home, or you have to FaceTime or Marco Polo them, whatever you need to do. Find those outlets and do that, because we all need those interactions.
We are planning to, as we talked about, model that data out so people can get a better understanding. And again, they're kind of our best guess, given all the data that's coming in throughout the nation, throughout the states that have gone a little bit ahead of us in cities. And so what I say, I'm going to make this very personal. The longer you can hold it out, you give me more time to plan. You give me more time to get the resources in place. If we start peaking tomorrow, it's going to be a lot more difficult. And so for everybody that's staying home, you're allowing your healthcare system, your public health department, for all of us to build the resources that we need. And so every day that you kind of comply, and again, it's the only tool I have. I don't have medicine, I don't have a vaccine, and I wish we could all go outside and just enjoy the spring. It's one of the best times we have in our region. But my goal is to get on the other side of that curve, and when we come out, it will be one good time. And that's where we're going to be. But we need to, you're buying us time, folks, and we appreciate every day that you buy us. So by staying put, staying home, you know, the reason that the April 30th is out, the governor's orders, is the modeling that's coming out statewide and nationwide. And so we continue to look at that, so we don't have a magic date, but we will be sharing you what we believe will look like our local numbers, and we'll be prepared to start doing that next week.
Right now, we're following state and national guidance on those types of projections.
Correct.
Okay.
Just add one thing. Very well said. Thank you, Dr. Martell. To complement what the mayor and Dr. Martell said, what is amazing to me about the synergy between what's the discussions at the federal, state, and local level, and it's a compliment to our local health department, is things are changing. I've watched discussions we've had where Dr. Martell is getting information from the state or federal level, and in the course of a conversation with hospital partners, working in a very synergistic way, they're taking their 20 or 30 years of experience, putting that to work with data and information that is changing multiple times in a day, and making changes as they see fit. The dynamic nature and the alignment between our healthcare systems and the conversation I was a party to this morning was incredible, the teamwork that I see. So when Dr. Martell says there's one health system right now, not three, I think I can speak for the mayors that it is evident in those discussions. We are working together, the rest of us, to buy time. Also released in this press conference, it's April 2nd, and you see the sheet that the health department put together. These are not Republican numbers or Democrat numbers or political numbers. This is information that is being shared and scrutinized by the health department, but shared by the health systems. And my point is the edge that we have today, the urgency in our voice, knowing we're going into a surge, as the mayor said, is I'm looking at 70 ventilators that's being reported out, 57 ICU beds available, and that's a fluid number that changes, and that's why you see, and I think that the health department and the city and all of our partners, the Emergency Operations Center deserves a ton of credit. They are sharing information with you because you are part of this team. They're sharing more information with you than other communities are sharing with their citizens because we know how important you are to making sure we flatten the curve. So if in a few weeks or 2 to 3 or 4 weeks we have flattened the curve and the reality is we don't get the hit that our experts are planning for, wouldn't that be worthy of celebration? Because that means that everybody that needed advanced care got it in some of the most world-class hospitals in the world that we have right here. That's when Dr. Martell is appealing to you to ask for your help to buy them a little more time. She knows we are up for this battle, but having a little more time allows us to serve those who need the most help when they need it. So thank you. Any other questions?
Yes, they're coming in here. I'll throw them out to the group. While we're talking about timing, my colleagues are seeing a disparity regarding turnaround times for COVID testing. Who is in charge of that and responsible for that?
We'll have Dr. Martell speak directly to the testing part.
I apologize, we keep forgetting to repeat our question. So the question is about who's responsible for turnaround time on the testing. So we continue to submit specimens for individuals who are hospitalized, congregate settings, and high priority groups that are in the hospital setting through what's called the Illinois Department of Public Health Lab. And we call those the PUIs, or persons under investigation. Those results are coming back to us now in about 48 hours. The private labs can be anywhere, out there from 5 to 7 days. But now that we have 33% out there, we know that those turnaround times are dropping. And remember, those are national contract labs through it. And so they are taking all the specimens, they're running them, 24/7 shifts. And so when they come out, that's, again, why we've had this discussion about should you get a test, when should you get a test, how long does it take to get a test result back. Obviously, we'd like them more timely, but I will tell you that everyone who's had a test, and we reaffirm this, when we get those logs from all of our healthcare providers, we follow up with a phone call to everyone who's had a test, and we tell them to isolate until those test results come back. So they are effectively not out moving about, potentially exposing others. So they're given specific directions to how to isolate in their homes, in the environments that they work in, so that we can begin the necessary process. So they are not out moving about waiting for a test result to come and potentially exposing others.
And as far as those tests, is there a cost associated with them?
Currently, there is the cost to testing through the Illinois Department of Public Health labs. There is no cost. And COVID-19 testing, my understanding has been that there is no charge for that based on risk.
Last week, we asked you whether Rockford University or Rockford Christian dormitories might be used as field hospitals. Where do we stand on that plan? And where might they be constructed or placed?
So when you're looking at, when you saw, and I'm going to give you some guiding principles, typically now these alternate care sites for mass hospitals, they're kind of constructed, we talked about this on more of like a ward basis, right, where you can see a large, because of the shortage of healthcare workers nationwide. You've heard this morning there was a whole discussion about the ventilator companies and the die casting that has to be made for all the pistons that go into them and the amount of turnaround that they have to do. But the bottom line is they'll tell you that some healthcare personnel have to be available. So the idea of private rooms where you're going to set people up in private rooms where you might need one-on-one staffing is probably not the model that we're going for. We're going to look at independent rooms, and if we need for healthcare workers who may not be able to return home, right? They're in the front lines, doffing and donning PPE all day, caring for critically ill individuals to give them some respite space. But there is, when you talk about critical care and mass care, you're typically not looking at kind of private type rooms.
As we got one last
Okay,
one.
one
for you
last.
guys, I promise.
Or is it?
And I'm cutting it off. We get temp tested as we enter this building.
Mhm.
Is there any recommendation for employers at large? Shouldn't they be testing any employees they have coming into their building?
The guidance continues to evolve on that. So certainly the sensitive workplaces, such as the long-term care facilities, the congregate settings, the jails, the daycares, they are all doing that as part. But remember, the fever is one symptom. But every individual, everybody in the community should be monitoring themselves on a daily basis. And if you become symptomatic, right, making sure that you take the extra effort of isolating yourselves from your other family members, so it may mean going to a separate room. I know the basement has been what some people say is that their isolation quarantine place. But really, because again, and not go into work. Every employer, we've stressed this from day one, if you are sick, stay home. This is not the time to tough it out, even if you're considered an essential worker, because you put not only, yourself at further, risk as you become sicker during the day, but you expose your coworkers, and then we have a whole potentially essential business down, and I come back to that part where you're not doing anybody a favor. You're not doing yourself a favor by coming into work and toughing it out. I know we have all done that in the past, but this is not the time. You need to stay home. So every individual should be monitoring themselves for signs and symptoms of illness and taking the appropriate action. Employers typically have put in more stringent guidelines of making sure that employees check in if they're sick. If they become sick on the work site, isolating them to a certain area so that they can leave immediately, so they can minimize the contact and exposure to the rest of the essential workforce that's there.
One last question for you, Dr. Martel. When we talk about alternative care facilities, is there an end goal target for having an additional amount of beds? I know you give out those numbers to us, but you mentioned you're looking at separate data and potential surges that we might have. Is there a target for you guys when it comes to alternative?
At this point, we're looking at how our data is now, and so part of it would be next week, take a look and see, based on our current capacity, how much the hospitals can surge up to. And then what do we need to then create additional capacity for? And I'm going to say from planning, most of us go for a worst case scenario, and then anything under that is we're great, but we're going to try and plan for the maximum we need to do so that we can effectively manage it and, again, be able to scale it up should we need it.
Thank you, everybody.
Thank you.
Thank you very much. Oh, okay. Nice job. I'll be right out.
You earned it, right?
Sure.
You have the first one. I